keyword in number 3.
Slowly, diaphragm and slight. Slight shortage of breath.
Okay.
I'm giving you the handout that you have a copy of this. And you can underline the keywords. I just underline them there.
Sure, I have one pen if you don't need it.
It's a red one, so it's going to be underlined. Why this rule is so important and so much attention paid to it? Again, because the technique is profound, is giving you profound changes, it's giving your body profound changes. It have to be performed in certain manner, and there is keywords slowly, slowly. Keyword is slowly. Any pushing, actually, in the cases of acute diseases, it's possible to push this technique through forcefully on people, and it was done. But this had to be done in stationary situation when the patients are in the room and practitioner also in the room monitoring them 24/7. That can be done, and it was done. Dr. Buteyko did a lot of that. But if you go out there and practice it on your own, that's how it should be done. Gradually, very slowly. All these changes have to come naturally. Okay? So slowly reduce volume and intensity of breathing by relaxing diaphragm. This is extremely important. So you reduce it not by choking yourself, but by relaxation. And until slight shortage of breathing. So your shortage of breathing have to be permanent, have to be kept all the time, but it have to be slight shortage of breathing. And it shouldn't have to be like scary or darkish or something like that. This is very important, so I'm underlining it one more time. Now, when you go home and you start practicing it, what do you think is the most important thing to start from? And last lecture people guessed correctly. Strangely enough, the first thing is get the proper water supply. It is not recommended to go through this technique with a regular tap water supply or bottled water supply. You have to get some clean water. You can use it, you can do it from the tap water, but you have to either boil it to get rid of chlorine, or you have to put it through some kind of filter, or at least you have to put it in the open for at least 6 hours that chlorine will evaporate. So tap water is not good.
Put a slice of lemon.
It won't kill the chlorine. The tap water is no good. Bottled water in plastic bottles also no good.
Do you know a good name for a purifying filter?
I cannot endorse anything. I didn't try anything. So what I'm doing at home, I'm boiling it and then I put it through a special filter from the Nikken company.
Nikken. Oh, yeah. I used to have a Nikken.
Nikken is good.
Because Nikken I had it under the counter.
Yeah, it's good. That's the only one company at the moment I can say is good.
Still they are working, huh? Because I bought it 2 or 3 years ago.
It's a different principle, yeah. It can still work.
Okay.
So this is the first thing you attempt to. Come on in. You need it.
So, okay, so what? Boiling
You have to get yourself a proper water supply.
And what do you do? Drink it?
Well, you have to drink water, but if you go through this course with the water filled with chlorine, it's not going to turn into it. You're going to be vulnerable first several weeks. You're going to be going through changes. And we're going to discuss these changes because these changes is called cleansing crisis. And I went through them all. Most of the people go through it because most of people, as you saw on that table, are not really healthy. They average healthy, but the health is above the line of norm, and most people are below the line of norm. They feel okay, but they're not healthy per se. So when they start practicing, they're getting discharged because there's no need anymore for the body to preserve the carbon dioxide by plumbing the cell with mucus or cholesterol or anything else. So the body would discharge all that material. It would come out in the form of inflammation, often, diarrhea, inflammation of all this part, of all the breathing apparatus here in the all the sinuses, they all will be cleansed one by one. You will have discharge. You will have kind of like a disease. It's called cleansing crisis, but it's look like a disease, but it's not a disease. It's disease in reverse order. Because I also noticed with my joints, last 2 years, every spring I go through that cleansing crisis, and it's looked like a joint disease. But strangely enough, after the crisis ended, you feel better than before, than previous year and 2 previous years. They feel stronger and younger. So that's not a disease of the joint, that's cleansing of the joint, because these 2 large joints accumulate a lot of phlegm in them. So when they cleanse, the body has no other way of getting rid of mucus but to make an inflammation. What does it mean? That the blood flow will go in there intensely, wash out things, and then it will go into some form, either diarrhea or urination or coughing or whatever. So, what is the signs of this cleansing crisis? It's deepening of the breathing. So your training will kind of fall back. When you're going to measure it, you will see that it's get deep again. And that's not bad. It's a crisis. It's 3-4 days, maximum 1 week. The crisis did not last long. So, and people getting scared because there's temperature. There can be a high temperature. My last crisis, which was during my original course, I was running 39 temperature for 3 days, and I was at that point at the refresher course, so all my roommates were doctors, so they were very concerned about me. They thought I'm dying or something, because on the last day I didn't sleep the whole day or night, and it seems to be kind of endless, all the discharge and temperature. But then all of a sudden in the morning it was cut off, and that's it. You're done. Because it's not disease, it's disease in reverse, the body cleansing itself. So high temperature, absence of appetite, nausea, tongue is covered, so you need to clean it in the morning as yogi do. Temporary return of the symptoms of all the illnesses which you experience, you can also experience. Say, if you had a gallbladder stones, you can experience pains in gallbladder or symptoms like stones temporarily for 3, 4, 5 days. Headaches, joint pains, pain in the place of all fractures and traumas, as I said. Also possible because body is sending their repairing kind of things, different repairing hormones and stuff, and it can reactivate the old trauma. Sweating, salivation, running nose, diarrhea, vomiting, discharge from the respiratory system, frequent urination, that's the first thing you will experience. You're going to go more frequent to the toilet, both in urination and bowel movement. The other thing you will experience that bowel movement will be regular like a clock. If you had problem before, in 2 weeks it will disappear. If you have it again every morning. So this is one of the effects. All the previously used drugs will come out through the skin and urine, and you might have a skin problem, skin rash. That's all the symptoms of the cleansing crisis. You should not be afraid of it, it's a good thing. It's not pleasant, and you have to go through it. Otherwise, if you use any remedies to suppress it or do anything to suppress it, then you will not progress in your reducing of your volume of breathing. You will stop at that level where you suppress the crisis, and it would not be cleansed. So either you have to back up from the technique and stop it using it, or you have to make one more attempt and still go through it. If the crisis is too much, you can back up and stop it and attempt second attempt. Then second one going to be less pronounced than the first one, possibly because you already kind of cleansed somewhere. But it's up to the person. If that thing happened, best way is to contact the practitioner and ask advice. What you do in this crisis situation, you still continue to practice, but with less effort, less time. Walking on the fresh air, nature, forest or park, very good help. Frequent warm shower, very good help. Everything with water, very good help. Water for some reason calming down all these things. And that's how you do. Drinking a lot of green tea or any other cleansing tea, and it will do. It will pass, and you will go to the next stage. Usually crisis is like, in the first attempt can be 3 or 2 crises. In the next levels can be 1 more. So altogether can be 4 or 5 crises during practice. After that, that's it, you're done, forever. As long as you're here, you don't need to experience anymore because you're done. If you continue to practice, keep the lifestyle congruent with that list I gave you. Don't do things which increase breathing and do things which decrease breathing. You're fine. It will never return. My mistake was that after the first course, I didn't realize that this is about philosophy. This is philosophy of non-greediness. I thought of it as a course of some practical exercise, and that was my mistake, because I slided back. I slided back because I started doing everything I was doing before, and that was not a healthy lifestyle. So I had to go through a second course myself without instructor, because at that time I was already instructor, and experience, not to that extent, but to a certain extent, things again, and bring myself back to normal. So make sure that you understand that this is about deep philosophical change. You have to abandon the previous stance in life that you need more, and realize that to be happy, healthy, and good in all aspects of your life, you need less, you don't need more. Like if you have the whole backyard filled with bushes of roses, you still can smell at the one time only 1 rose. You cannot smell them all. It's irrelevant for you whether you smell 1 or you have hundreds of bushes with thousands of roses. You still smell 1 rose. And you enjoy 1 rose. And you get happy from that. Right? Yeah. Now also realize that this practice taught as breathing technique, but it's really a state of consciousness. You're falling into a certain state of consciousness. It's a relaxed, meditative state of consciousness, and after you first experience it, that's pretty much it. You got it. Now you have to practice it and enlarge it and make it through the day more often. That's about it. So if you make it through the day 1 hour, you're going to progress through the course. But you're going to add one more thing. You're going to check your pulse, right? When you check your pulse, you're actually doing exercise. Because this is the second part. Why it is not taught in the beginning? Because people tend to use pause as the main technique to change the breathing pattern, and that's incorrect. Pause is giving a quick result, but they're dangerous if you practice them without that first part, that shallow breathing. If you practice just pauses, as divers do, and do not change your lifestyle and thinking, it can turn down in the breakage of the breathing pattern, and you would have to re-establish it and go through all kind of disease-like symptoms. So the second part of this technique is checking of the pulse. So we're checking the control pulse, which is, does everyone have on the cell phones the timer? Okay, so open up the application with the timers. It is very important to check the normal pulse, control pulse, so-called, in the morning, first time in the morning. After you calm down a little bit your breathing, and then you check out your pulse. Okay, so I'm opening the stopwatch. You have to be in a calm state. You have to eat at least an hour after 8, and you don't have to eat a lot of sugar and do hard physical work, because that will change the pulse naturally, so it would not be correct measurement. So if you're in that normal state, that's what you do. You just stop breathing. You start your stopwatch, and you stop breathing and wait until the first serious urge will appear. Okay? Do that just now.
This pause is between the inhale or exhale, or not just?
got?
I don't know.
You didn't use your...
No.
Okay, do it again, use it.
Will you bring this up?
Yeah, well, you have to measure, that's what you do.
To give you mine?
That's how you measure your progress and understand what's going on.
So I go to the timer, yeah?
How much?
Until the natural urge comes.
Natural.
Yes, you're not real.
Well, you do it the next time, you do the maximum.
Oh, well, shit.
How much?
I just did 45 seconds, but I was holding my breath, not for the natural urge.
Okay, that's not bad. That's equals like 20 of control. 25 of control. The reason we have such a low control pause because we just ate. And you can do nothing about it. So you have to wait 1 hour. So what you do like 3 days of control pause, and then you take average, and that's what we're going to be a real
I don't
control
understand
pause.
when I have to do the pause. When I'm inhaling or exhaling?
When you're exhaling, it's between breathing cycle. Inhale, exhale, then you do the pause
And the pause.
until the first serious natural urge to breathe in.
Okay, let's see.
You are not holding. You just feel when it becomes natural, and that's when you hit the button.
So, among these pauses, they serve two purposes, these pauses. They serve the purpose of measuring, and they also serve the purpose of training. Because you can do what you just did, that's training. But this is second technique plus to the first one. It can only be supplementary to the first one. You cannot practice that technique alone, and you cannot put more emphasis on it. You have to put more emphasis on the first one, relaxation, and decreasing the breathing through relaxation, and then you can add to it the pauses, which is very good. And I suggest you to do so. Usually, during the exercise, like you have 20 minutes to exercise, you can do 3 or 4 control pauses and check how it's going, and that's going to be also second part of the exercise, control pause. Now you have 2 techniques combined together. Now, the funny thing about control pause, that you have to get your attention elsewhere, because if your attention will be on the breathing and control pause, it's going to be shorter, much shorter. So you have to, if you saw, I looked in the window and saw something, you have to bring your attention elsewhere, not to think about measurement or breathing or everything or that, then you're going to get the right measurement. Because if you would think of breathing and keeping the control pose, it's going to be like almost twice shorter than it should.
Yes, it is.
This is a very practical thing which you have no, otherwise your measurement will be incorrect, you will be scared that you're doing no good, but you're actually doing good. Now, nighttime. There is a big problem with nighttime, and we have to address it separately. The reason for it is naturally, in the nighttime, the breathing is increasing and getting deeper. Even if you sleep properly on the stomach, it still will increase at the nighttime, especially close to the morning, as we discussed.
Why?
So what?
Why?
It's just how it's naturally go. It's a cycle of the changes of the body in the day and night, and that's what happened. In the nighttime, closer to the morning, the breathing increases. The body is getting ready for waking up. So it's bringing the breathing pattern to the expected activities. That's why it's happening. So we're doing 2 things. First thing, because most of the people who would be on the line 1 down from norm, 2 down from norm, and everything else, most of these people would sleep with their mouth open and would not know about it and they have no idea that they actually open your mouth in the nighttime. But if you would tape it with some kind of night vision camera, you will see that they do open the mouth, because they open like a corner.
But we can't control when our mouth is open.
That's the problem. That's the problem of the nighttime, because if you would sleep in the night even a couple hours with the mouth open, all your previous day of training will go to waste. So what you do for the first, I did it for the first 4 weeks.
You glue your mouth.
You tape your mouth with the medical tape.
No, I'm not doing that.
You tape your mouth with medical tape. You probably don't need it. I can feel that you're more or less alright. But most of the people who with asthma and God forbid cancer or everything else, they have to do it. Otherwise the practice is not effective, because in the nighttime it's going to be lost. So you have to tape your mouth for the first 4 weeks every night. There is a couple of tapes in the pharmacy. Maybe if we would meet again, or you would ask me, I would figure out which one is the best, but it have to be non-allergic. It doesn't have to be too strong, yet it have to be strong enough. There's a couple of tapes which match this in Canada. You can buy them in Shoppers Drug Mart or elsewhere, and they do. And that's all you do. You go into the bed, so you close it, getting up, you open it, and start your day. Now, second,
a cold or your nose is plugged or something.
That's a good question. Usually that question is asked. There are several techniques of opening the nose in this course of training, and the most simple of them is massaging the points of the right and the left of the nose here. You can do it and it's going to open. The second one is jumping on the feet, that you little bit beat up your feet against the floor like this. For some reason that would open the nose. Probably there are some points there or something like that. If those two techniques practice, they usually open the nose.
Jane, do you do this?
No problem.
Which one?
You also can watch them.
I did breathe in Australia cover. This one I didn't know all of the techniques of this one.
It's very, it's technical. There's a lot of technicality to this.
Well,
You aren't kidding, were you?
that's why it's effective.
That's why it's effective.
Also, you can wash your nose with the yoga little that saucer thing.
The teapot.
Yeah.
That's nasty. My mom does.
Or you can wash it with your hand. You can put water in the hand, close one nostril,
That's nasty.
and then put it
What
in the
about
mouth.
those ones they're selling in pharmacy? You're just breathing with a bottle, you put a...
Yeah, you can wash your nose with that, but there is no need really. You can use your hand as well.
Ah.
Whatever you need. So
Do I need a
that
salt
would
or-
address that problem. Salt would do better, because salt will dry up a little bit. Don't put too much. Now, second thing, remember we talked about those jackets for the stress relief for the dogs? So that's what you do in the night time when you're seriously practicing. You're bandaging yourself with a bandage. That's providing that you unhealthy